Okay, so we are live and recording. Welcome to the Domus Search Leadership Podcast, where we speak to C-suite leaders and innovators within various healthcare industries across Europe. Domus Search are a leading executive search firm in the field of biotech, medtech, digital health, and I'm absolutely delighted to be joined today by Sam Shah, who is Chief Medical Strategy Officer and Senior Digital Advisor to many industries. Welcome to the podcast, Sam.
Hello, great to join you today.
Thank you, Sam. Thank you, Sam. I know you've been very, very busy in your schedule as well of conferences, events, and podcasts. And I'll be sharing this with a very wide audience. And you've got like we were talking earlier on, a CV that is extremely impressive and very long. Perhaps for the benefit of the audience, would you mind giving us a bit of an overview as to your career, your fascinating career through dental and now law as well? And I'm really, really fascinated as well.
It has definitely been a busy time recently. Things that we're doing at Numan, where I spend most of my time. So Numan is one of the most known digital health providers in the field of men's health. So we started off by treating men, and that's been great. We've been launching new product areas recently, so focusing on weight loss. So that's been particularly interesting, helping men access services. But of course, like anything, when launching a new area, it takes a bit of time. So that's been keeping me busy. But equally, the sort of conferencing, as you mentioned, has been quite busy as well. We had Healthcare Excellence Through Technology last week in London, and that's one of Europe's biggest health tech events of the year. And so we have thousands of people come through listening to discussions from everything to do with interoperability and change, all the way through to culture, workforce, retention. So a wide range of discussions covering digital health and tech. But, no one week is ever the same. And I'm really lucky that I get to work with a whole range of different entities. So bit about me, I started life off as a clinician, and a bit before that I worked in retail technology and financial services, but spent most of my early career in healthcare. And then after training clinically, initially as a dentist, I went into a hospital, and then following that decided to go and train in public health, then health economics, and then law, and then came back into a mixture of roles in healthcare. And so I still clinically practice, but I've spread myself across a number of sectors the last few years. And I was previously the National Director for Digital Development in NHS England. And then I went to the Department for International Trade as their Global Clinical and Digital Advisor, and then went over into the world of private equity, and then eventually a startup. So that's been sort of where I've come from and gone to. And what's amazing for anyone sort of going into the C-suite space is that every single experience, when you add them together, effectively determines both who you sort of are, but also how you might lead your team and what you might want to do to develop yourself, but at the same time, the flavor you bring to your team. So yeah, you're absolutely right. It's been a busy time, but equally exciting.
Yeah, fantastic. And are you traveling much at the moment outside of the UK? Do you venture out into mainland Europe?
Well, I think travel has started up again. It's a slightly different way. I've been
Yeah.
taking trains more than planes. That's been interesting. I think our conscious probably playing for all of us at the moment, and I've sort of enjoyed getting the train to Europe. And a couple of weeks ago, I went to Vienna for the Global Obesity Summit, which was, again, great to go to. And a lot of discussion around how do we use technology, digital in the space of tackling global problem, which is obesity. And that was good to connect with colleagues, hear what's happening, life sciences and pharma, what's happening medtech to support this, and what new technology is on the horizon that could support people access better services and really address something that is a global issue.
Absolutely. And I started speaking with a client probably mid last year as well in India, who were developing a digital therapeutics platform for various therapeutic areas. And it started with type 2 diabetes. And they went on to build software as a medical device. And you could see that connection between all of the elements and pharma and license and how we're all coming together to tackle it as well. And maybe you're in a great place to talk about what's really where the gaps have been, what seems to be working now as well, and where we're heading with the connection between the tech and the innovation and the problem.
I think you just touched on it there as well. I think we're solving problems in a different way.
Yeah.
So we're no longer just coming up with piecemeal, isolated solutions, whether it happens to be telehealth or online consulting or some sort of personal diary or app. We're seeing a combination of those things. And that's a great example around diabetes, but equally the same exists across many disease areas and many problems of joining together perhaps software, the drug or the device itself, and sometimes including the monitoring technology as well. We're seeing combined technologies begin to really take off. And we've seen that in the diabetes space. We're also seeing it in the treatment of asthma, and it's happening in other disease areas as well. And I see the sophistication of that continuously improving. And certainly if we look at digital therapeutics, and you take somewhere like Germany, they're really leading the way on how to drive adoption. And there's still a long way to go around the quality assurance, safety of digital therapeutics, the effectiveness of them. But certainly around adoption, Germany has incentivized adoption, and they're certainly leading the way, which has almost led to proliferation in the market of startups and scale-ups touching the German area, the German regions, as well as the DAX region more generally. Yeah. We're getting more developers developing products that suit that market. But across the system, across not just the UK, but globally, I think we're all facing the same challenges. I think some of the big challenges of interoperability and integration still remain. I think in 50 years' time, we'll probably still be having the same discussion of data sharing. How do we get systems and services to connect? We're still seeing the big problems of EHRs and EPRs, so electronic health records and electronic patient records. You know, are they really fit for purpose? Do organizations build one themselves? Do they buy it? Do they have one? Do they have many? Do they connect them? Do they separate out the data layer and the application layer? These are big questions. They haven't gone away. Then we've got the problems of telehealth. We've got so many telehealth providers. In every country I visit, they've got an excess of telehealth providers, no shortage of them. But are we going to see consolidation this year? And I think we will. I think we're already beginning to see some big players in the market starting to consolidate because there simply are too many players. They're not all going to attract the same amount of funding. It's going to be difficult for governments to keep investing in them. Yes. And at the same time, the population doesn't want necessarily to have lots of different access points, but wants perhaps an easier, frictionless route to getting to services. And then on the app side, we're seeing, again, another increase in the volume of health-related apps that are out there. I've seen lots relating to sleep. I've seen lots relating to anxiety, depression. There's many more coming on the horizon around diet and lifestyle. Yeah. So seems to be no shortage of solutions. I think the difficulty is the underlying problems, though, in healthcare haven't changed. And we still have the issue of data transparency, data sharing, and how do we make better decisions for citizens, either for themselves or through a clinician.
Absolutely. And when you talk about combined technology, is it how all these players coming into the markets and all these startups are working together? And also, I guess when I think about the UK in very layman's terms, I just think of one health system, albeit we have a private and we have a public sector as well. Yeah, how do they all communicate to a place where it's like benefiting the consumer? And do you also think, just maybe touching on that and previous experience, that your retail technology background as well helps you craft better decisions based on the consumer and what's best for the consumer and how the consumer behaves, or the person, I guess, adopting the technology?
I mean, I think the whole debate around consumer, customer, service user, patient is an ongoing debate that many people in healthcare struggle with. And my view on it is that how we might label ourselves or someone else depends on the context of the conversation. In fact, everyone's a consumer. They're also a customer. They also happen to be a service user. And sometimes they happen to be patients, maybe when they're unwell or receiving treatment. And I do think, certainly for me personally, my experience of developing consumer type systems and trying to reduce friction in a consumer environment certainly influences how I view healthcare. Because of course, there's large parts of healthcare that have to be delivered by a clinician. That's not going to go away.
Yeah.
People like me and other clinicians are still going to have to treat patients and see patients and prescribe things and monitor patients and support people. That won't really change. How we do it and how people access our services, how much people can do things for themselves will change. As technology matures, there'll be some things that we all used to do ourselves, that we now do ourselves, that once upon a time were delivered through a clinician. And classically, we can see that already with certain things like, even medication. Some of that's changed from being prescribed, being over the counter, to now being generally available. And we see that shift as we improve our safety mechanisms, surveillance mechanisms. All of these things allow a culture shift. And certainly taking the lens of the consumer, the user, changes certainly how I and many others perhaps are building their products and services. And I think it's an important set of skills. If I think about healthcare, and certainly take the UK, and you raised a good question there about the UK, many people think of the UK as one system. Well, ironically, we have one set of regulations that cover the whole of UK. We then have country level regulation for each of the 4 countries in the UK. So England, Scotland, Wales, and Northern Ireland have their own country level healthcare regulation. We then even have system level regulation where the NHS has its own regulation specific to the NHS in each of those countries, which also doesn't apply to the private sector in each of those countries. So you can imagine how confusing this landscape is. And so for a digital health provider or any tech provider or even any drug developer, it's very hard navigating that and understanding how to operate in that. One thing I certainly see is many people in the NHS as one dominant part of the system have mainly spent most of their careers in the NHS. So they may not have had the benefit of working in a consumer space, dealing with the digital era. So when I think about C-suite leaders, either in the system, public sector, or outside, I think a good set of skills for anyone to have, whether you're working in medtech, health tech, digital health, is just understanding and being aware of the evolution of the digital era from the internet, really, and what that's changed, how it's changed people's interactions, and what that might mean for the development of services and products going forwards. And I think get that recognition of how consumers self-serve will help shape what we build.
And a couple of things on that as well. And one thing I joke about with my partner, because she's a primary school teacher, is I say, you've never left school. You went to school, you went to uni, you went back to school, you've never left school. And sometimes when we talk about her day and her life and challenges that she has, well, I'm often able to come up with solutions that she or her colleagues might not have thought about, because I've been outside of the sector and then had kids going through the system as well, and can make those. And also as an asthma sufferer for 32 of my 40 years as well, or diagnosed anyway, I've been quite frustrated over the years about the lack of innovation, but actually over the last few years, I've started to see real innovation come from the startups and through digital, and how to manage asthma. And actually, what I found on a personal level is a lot of my asthma is linked to fitness level as well. So I do various things there, but I've been very frustrated with the system of treating asthma for many years. Is very much an annual checkup and a little chit chat and blow into this and see how you go there. It's got to have moved on further than that. And I'm glad to see that it has.
It's interesting though, it has moved on, but the system in which we operate hasn't moved on. So the NHS is a great system. It's one of the most efficient health systems in the world. And we see this in other health systems around the world as well. They are mainly dealing with illness, dealing with unwellness, dealing with reactive healthcare. And if we think about something like asthma, what we're trying to do is move to a proactive form of healthcare, helping support people monitor, manage on a longitudinal basis to avoid exacerbation and to prevent the sequelae that then takes place when people then may have an acute exacerbation of asthma. And this is where you can really see technology has got a big part to play. And some of the pharma companies have developed technology, smart inhalers, for example, that have got the feedback loops built in. And I think it's for anyone entering the sector, you may not need to be an expert in all of these things, but it's great to have an awareness of what's happening. It's not even just the technology, it's understanding how to evaluate safety, how do you evaluate the effectiveness of the efficacy of a particular product? Because it might be an amazing product, but does it really do the thing that you want it to do and serve the right population? but that's a great example of just raising the awareness levels amongst C-suite leaders of what is the art of the possible. Because whether you're a CFO or a CEO or a chief digital officer, it might not be your exact area, but just sort of knowing what's out there might help shape what you do next.
Yeah, absolutely. And maybe that's a good segue into talking about. I know we haven't necessarily touched on where you see it going from here and how does it get better and improve. Maybe that's a good point to raise there in your travels and experiences and through chairing HET as well. You're bringing together a forum of leaders, I expect, who are innovating in these areas. Where do you see things going next?
Well, I mean, I'm going to get my crystal ball out and have a look. But
The
that's
lucky April.
yeah, exactly. See what word it comes up with. But the big problem we've got globally is the burden of disease is not going down. Whether it's non-communicable disease or communicable disease, we're now in a situation where in a post-COVID era or COVID era where we have more infectious type diseases that we have to address, whether it's COVID, monkeypox, the emergence or re-emergence of polio, and many, many more that are emerging again. So communicable diseases haven't gone away. And for a little while, we weren't so focused on them. But I think it's fair to say that the light has truly been shone on that set of problems. We've then got the non-communicable diseases that again have a significant part of the health burden of society: obesity, cardiovascular disease, and we can't forget mental health that has always existed, but we now recognize it more than we ever did before. And perhaps some of the problems of the last 2 years have contributed to an increase in the prevalence of mental health. So we've got a set of problems affecting us in every part of the world. Alongside that, we've of course got the economic issues, but the workforce problems. Every single colleague I speak to around the world is faced with the same problems around healthcare workforce and digital healthcare workforce. We simply just don't have enough people in enough roles to help support people who might become unwell. And we don't have enough people who are focusing on the preventative agenda and helping people avoid becoming ill, unwell. And of course, we don't have the resourcing. So that requires us all to think in a different way. It's the driver of some innovation, which means that we might end up changing our risk appetite in certain places, but we might also start developing new products and services that people can use themselves as part of their access to healthcare. So it doesn't replace the doctor, it doesn't replace the clinician, it doesn't replace accessing services, but it might help us by using technology, make these interactions more efficient. So things that I see happening, well, increased data sharing, I think that's a given. Patients' own access to their health record, it's a thing that we're seeing in every area of the world, and certainly something I hope that becomes more useful in the UK. Digital therapeutics, the use of technology as part of an intervention. Now, it's a broad area, the whole broad category, but more of those where we see something that's both more personalized, easy to adopt, but also has that feedback loop built in. Now, I've used a big term that covers a lot of things there, but it's much, much deeper than that. And then we see the advent of using data. Now, I'm not going to discuss AI because I'm certainly not an expert in AI, and lots more people out there are, but we certainly see the benefits of using data in order to gain insights, result in intelligence that we can apply to identify people at risk much sooner and also treat people in a way that might be more personalized to them based on patterns and trends that we see. Yes. And then on top of that, we've of course got what's happening in the sort of digital technology space. We've got platforms coming together for population health, better planning tools, and better predictive tools that are in their emergence. And then when it comes to telemedicine, I hope and very much hope that we have better ways of understanding interactions. We could get to a point where we're having this online discussion, but when that's happening with a clinician, will it give the clinician some insights about an individual? I've certainly seen some technology that does that, helps identify someone really listening, are they really understanding, what cues are emerging from the discussion? And I think that will help improve the quality of clinical interactions. That's some of the things we're seeing, but I think there's still a long way to go. And the starting point is solving the access problem.
Absolutely. And a conversation that I have quite often as well with startup founders as well is around gaining access to funding as well, when they're not necessarily able to to demonstrate revenue, the frustration of a great product that may never get to market, or may go through a university or spin out of a university, which but never sees the light of day, unfortunately, because it's not deemed a viable investment. Do you think there's enough startup founders coming through with great ideas, or do you think people are taking the risk? What do you think?
I think there's no shortage of ideas, whether it's the UK, Australia, Canada, Middle East. I've seen so many amazing ideas and concepts, even some things that have gone through to prototype. And there are endless solutions coming on the market for a different range of problems.
Yeah.
And I don't think that's a bad thing. I think that drives in itself will drive more ideation, and it will drive people to be inventive and solve problems in a different way.
Yeah.
One of the biggest challenges is, of course, funding and resourcing. And it wasn't so much of a problem last year or the year before, but now as the economics globally have changed, I can certainly see that startup funding is more difficult than it was, but it hasn't gone away.
Yeah.
Certainly for very good ideas. And it's not just about the idea. It's the idea. It's the team that's delivering the idea. And the market that it's going into. Is that market ready for it? And we've seen examples of this over the years where there have been some amazing ideas. The market isn't ready. Or there's an amazing idea, but the team that needs to execute it might need to change. Yes. And all three of those things, I think, are really important together. Yeah. And I would certainly recommend people taking time to get the right team around them, because I think that's equally as important as having the great ideas. Yeah. And then it's about trying to work out what that fit is. And it may not be the part of the world in which the ideas come from. It might be in another part of the world. So I would say we're in a global space for innovation, more so than even anything country specific. And one of the best things is connecting people from different parts of the world to come together and drive adoption. So you're quite right. There is no shortage of ideas or even solutions. One of the problems is the resourcing and getting health system to adopt. Yeah. Because selling into the UK in the dominant NHS, it's very different to selling to insurers or providers in Germany or big provider groups in the US. And I think it's recognizing that it is different. And then for those people looking at global solutions, they have to approach those markets in a different way to what they would do in their home market.
That's a really good point. And I do see that as well, that there's plenty of funding out there. It's almost like the barrier to getting the funding has become more focused, and then leading on to the team or the person with the idea to get focused. And maybe while we're on the subject of the right team and the right skills as well, and looking back as you've grown through your career, and you're now looking across an organization from a leadership standpoint as well, what are the key skills that you're seeing that are really highly valuable or perhaps lacking? I appreciate that leadership skills are not genetically inherited, and you've got to have the experience to gain the experience. Are there any key things that you're seeing or patterns that are really helping support somebody's career as they ascend through the ranks?
It's really interesting. If you'd asked me this 10 or 15 years ago, I probably would have a very different view on it. I think my view now is it's not really so much about a set of skills. It's more about a certain mindset. And it's not even about having the same mindset, but I think it's having the openness of thought, the ability for people to think in a way that is creative and that spans domains and functions in an organization. So I think of it as cross-functional thinking. Can that individual reach into any part of the organization and turn their hand to it? They don't need to be the expert in it, but can they turn their hand to it? Can they speak to that team, recognize their problems, whether that's finance or HR or operations or development? Can they at least understand what those teams are trying to do? Can they work in a way that will drive the values of the organization? And that's important. Have they got the skills to sort of develop teams and roadmaps and come up with strategy? Is that something they can do, or can they lean into the people that will help them do it? And most importantly, especially in the current climate we're in, is can people collaborate? And I think those are interesting approaches. Yeah. Now these days when we recruit people in any organization, I think there's an acceptance that we shouldn't be looking for the perfect person, because actually if you're taking someone that you think is the perfect person, well, do they really need the role? Because surely we should be looking at people that we can develop and they will grow and develop in the role, because that will keep them interested. Because if
Yes.
they come into an organization and they've got everything, where are they going to develop? How are they going to grow? Maybe it's not the right role for them.
Yeah.
And we've got to think carefully about this, because otherwise we're not going to end up retaining people and keeping people interested in what they're doing. So I think these are things I've certainly learned more of in the last few years than perhaps 10, 15 years ago.
Yeah.
The other thing I would say is recognizing as a leader that part of your role is to help people grow. So can you advocate for them when they're not there? Can you put your teams and people in the organization on the pedestal when they're not in the room and help them grow and be a beacon in the organization? Can you help people to evolve from where they've necessarily come into an organization to think in that broad way and succession plan? And this comes with time. It comes with having security in the role that you're in. It comes from being confident and comfortable in your own skin, as it were. And I think a big thing for leaders is recognizing that society is organized in a certain way that may not necessarily be the right way, and the way we've always done it may not be right. And public sector has a lot to learn from this. I see in the private sector, we're much more open about recognizing and discussing failure, tackling it, and accepting it's part of the growth process. In public sector, it's less accepted. And I don't mean failing on the product side, but certainly if you make mistakes in the public sector, it's less talked about, less discussed. And the big thing I think about being a leader is recognizing our own inherent biases that we all have in every single walk of life. And I'm much more comfortable about accepting my biases around what people may or may not do based on their experience, and challenging that and being challenged on it. Certainly, I would say in public sector, it's more difficult. I've seen the fact that a lot of public sector roles are people picked from the same club. And if we want to get diversity of thought, if we want to get different outcomes for society, I would almost urge my public sector colleagues to start recruiting from a different pool of people that have got experiences outside of the system, that haven't been haven't been career civil servants, public servants, but take people that had hybrid careers and take people that had very different experiences if we want a different outcome.
Absolutely. You touched on so many really fascinating points there, and really interesting. And the topic of retention as well has come up over more prevalent in conversation over the last few years. It's not just, I think it was almost like wasteful that people wouldn't talk about retention. We'll just hire them. Yeah, that's fine. But forgetting 3 months later, it's not quite a right fit. And touching on the point there where there is no stretch, the perfect candidate has no reason to stay, really. Somebody offers them another 20 grand, they're gone, so to speak. So it's so important, isn't it, to think about what's next for them. And I know LinkedIn used to think about this many, many years ago. They talked about tours of duty, and they would always be talking to their staff at every level, what's next for you in your career, and can we facilitate that? And if not, we encourage you to look out in the market. So just having that open, diverse thought as well is so fascinating.
And it is, and so I was interviewing someone the other day, and they sort of imparted to me how they wanted to do this forever. And I said, well, actually, you're probably not going to do this forever. You're probably going to do this for 18 to 24 months at the most. So what we've got to think about is what you're going to learn and develop in this role, ready for you to apply for your next step up. And success is that you do something else, whether it's here or somewhere else.
Yes.
But no longer are people going to be doing jobs for life. Portfolio careers are real. And actually, I think it's healthy for both recruiters and applicants both to recognize that is the reality of where we are. Yes. And that in itself is a richness.
Yes, absolutely. I saw a video online, actually, of somebody a little while ago, and he talked about the evolution of the workforce over years when there wasn't as much choice, and the job for life was not just because they wanted to stay there for 50 years. And he said, loyalty doesn't exist, but necessity to put the food on the table exists. And that's why they stayed there for a very, very long time. And then there was another generation that wanted to build a better life for the future, the 60, 70, 50, 60, 70, that baby boomer, which was growing industries and economies. And now we're in a place where we have all the luxuries, and we don't necessarily need to stay somewhere for 25, 30 years, where we have choice. And now it is about finding your place in the world and where you best fit. And unfortunately, we're not getting the lifers anymore, recognizing that.
Completely. And I think that we'll see that shift we're seeing that shift globally, certainly in private markets. Yeah. I think we'll also see that in public sector space as well. We'll see that change start to influence what happens elsewhere.
Yeah. Did you ever read Black Box Thinking, by the way, by Matthew Syed?
I did indeed.
Yeah. Okay. You just made me think about the public sector embracing failure, so to speak. I thought that was very interesting.
And it is really difficult because politicians don't like to talk about failure. And ultimately, politicians, whether it's the UK or elsewhere, want to talk about a good story. They want to have something these days to tweet about or post out there online, some soundbite. Yeah. And the reality is that the failure is a real thing, and we shouldn't shy away from it. It happens. It's always happened, but we just haven't talked about it.
Yeah, absolutely. No, it's been really fascinating. And I imagine we could talk for hours, hours on end as well. And I'm really grateful as well that we touched on so many different parts of the industry, technology, people. I'm so fascinated how no matter how quick technology and innovation moves, it's always attached to a person or a team, and every opportunity seems to be aligned to a person or a team or an idea. Important to recognize.
Yeah, totally. And people are at the center of this. People are there as part of the reason we all exist and the reason we solve problems together. And my message to anyone is just remember who is the person or the type of person that we're doing this for. If you're in health tech, med tech, pharma, who's that person that we're creating this for, and keep them in mind.
Absolutely. And when I speak to a number, in fact, I'm doing a lot of work in Germany at the moment, and a lot of the senior candidates that I speak to are often telling me now, or something that is very common in every conversation, is has to be mission, purpose, vision led. And they will go through to name certain companies that they'll never join because they don't align to the values, which I find really interesting. And looking back, and I think you're a perfect example of somebody who probably doesn't have any regrets with their career. You've gone in various directions and grown really nicely across various different spaces. But looking back, and perhaps this doesn't apply to you, but looking back, would you have given your younger self any other advice in your 20s, let's say, when you're first coming onto the scene of work life?
I expect everyone probably worries about what's their career going to be, what are they going to do, what are they going to become, where are they going to focus on? And we probably all spend a lot of time worrying about that. I think my advice to anyone now, whether it's in medicine, dentistry, law, public health, anything else out there, is actually just go and do what you enjoy in the moment. You can always change your mind, do something else. And we live in a world where it is entirely possible to change careers, do other things, create the opportunities. And there are ways of doing it. It won't always be immediate. It won't always be perfect, but almost make the most of every opportunity, because you'll take something from it that will apply to the next thing that you won't even know about at that point in time.
Absolutely. Oh, great advice. I imagine the last quarter of the year as well, you've got a lot going on with Numan and various other projects as well. Are we likely to see you anywhere else on the sort of global scene of conferences, events, digital healthcare platforms? What's next for you in the next few months?
Well, I never say no, because I no doubt will pop up on something or the other over the next few months. Yeah. I've got a great discussion happening later this week with the Traveling Doctors Society. It's happening at the end of this week. And then, a big exciting thing for us is the UCL Global Business School for Health, where we are developing the future cadre of digital health entrepreneurs and leaders through our program in the Global Business School there. And that's been really interesting. So we'll be continuing that this term and helping support people understand everything from digital health research, how to create startups, all the way through to how they might develop new products and services for the population. So there'll be a lot more of that, and we'll see a lot more of that posted online as well.
Fantastic. Well, I'll make sure I share everything with the wider audience as much as I possibly can in the links. But I think maybe that's a perfect way to sign off and say thank you so much, Professor Sam Shah, for your time and insight, and really excited to see what the future holds for Numan and all the other ventures that you're involved in as well.
It's been a real pleasure. Thank you, and thanks for everyone that is listening.
Brilliant. Thank you, Sam. See you soon.